What is the role of chiropractic for patients with whiplash injuries? The Virginia Chiropractic Association has produced this presentation to help you decide which patients can benefit from chiropractic management. Americans experience approximately 5.4 million motor vehicle crashes every year. The resulting injuries to the human frame carry tremendous human and economic costs. Cervical acceleration-deceleration syndrome, or whiplash, results from the whipping motion of the cervical spine during rear impact collisions. During motor vehicle accidents, and possibly in certain collision sports, the cervical spine can briefly assume a pathological S-shaped curve as the lower cervical vertebrae extend to track with the accelerating torso, while the upper cervical spine, linked to the occipital mass, reaches peak flexion in as little as 81 milliseconds. Cervical collars sometimes do more harm than good, and anti-inflammatory medications may actually weaken ligaments and tendons while prolonging healing times. Optimally managing the cervical acceleration-deceleration syndrome means addressing the inflammatory components of the injury, but it also requires attention to scar tissue formation and altered motion patterns. Doctors of chiropractic address all components of the cervical acceleration-deceleration syndrome, including muscles, supporting ligaments, and damaged or inflamed joint capsules, tendon injuries, and the neurological retraining necessary to achieve prompt and maximum recovery. Chiropractic training focuses on manipulation of affected articulations and musculature, as well as specific therapeutic rehabilitative exercises. By optimally aligning scar tissue and through retraining local and regional patterns, chiropractic claims to achieve superior results. But what does the literature say? A 1996 study in the medical journal Injury showed 93% improvement in chronic whiplash cases treated with chiropractic methods. That's a stunningly positive outcome for chronic cases. A subsequent analysis of 93 chronic whiplash cases showed improvement in 74% of chronic cases after an average of 19.3 chiropractic manipulative therapeutic encounters. If chiropractic management achieves these results in chronic cases, imagine the results for your injured patient you refer early in the course of the injury. Passive modalities, bed rest, cervical collars, and pharmaceutical management of whiplash have proven a dismal failure as management tools for many conditions, and not just cervical spine trauma. Doctors of chiropractic are comprehensively trained in restoring normal motion patterns, which is the key to optimal recovery. To find a doctor of chiropractic in your area, visit the Virginia Chiropractic Association online at www.virginiachiropractic.org, or just ask your colleagues and patients. Doubtless, they know which chiropractic professionals have earned a reputation for excellence. Thank you so much for taking the time to learn more about chiropractic's growing role in helping your patients with the cervical acceleration-deceleration syndrome. We look forward to being part of your healthcare team.